Good morning and welcome to Hot Seat. My guest, been looking forward to this, the Commissioner of Health, Keith Reed. How are you, Commissioner?
I'm doing very well. Thank you for having me.
Well, it's good to see you. And so there has been, the last 5 to 6 years at Oklahoma State Department of Health has been a very interesting time, to say the least, right? The financial difficulties and then the chaos of COVID. But you've been there now trying to look a new mission, a new culture. These things affected how you're going forward. So let's just start with that. How did the past impact where you want to go in the future?
Yeah, absolutely. You're right. The last 5, 6 years has been a challenge for the Oklahoma State Department of Health. You know, you're going back late 2017, early 2018. We lost about 20% of our workforce after a bit of a financial mishap, we'll call it. Then we went through a period of rebuilding after the loss of those 400 employees. And when we really started to get some momentum on that rebuild, COVID hit, early 2020. And with that, you know, we had to redirect all of our resources into the pandemic response. So it's been a difficult 5 years for us to get really refocused and get the recovery going. But I feel good about where we're at right now. We've been focusing the last 18 months on some transformation projects. So I feel like we're going in a really good direction right now.
Okay, so you have been on a job for 18 months. How long did it really take you to get your arms around the situation?
Well, fortunately, I've been in a position that I was able to, you know, observe from a front row seat what was happening and experience it in the agency, being at a deputy commissioner level. So I had a pretty good idea of where we're at. We've been working with a team on really doing internal assessments to understand where we needed to go. So I felt good about the direction that we needed to go, and we were able to immediately implement that with a transformation plan, really focusing on 3 core pillars. We were looking at strengthening our core, making sure we were operationally strong. We were looking at managing our portfolio, making sure that what we were doing as an agency is what the citizens of Oklahoma needed us to do and what the government needed us to be doing. And then finally, really looking at innovate in public health. For too many years, we've been kind of on that trailing edge of public health. We know that we need to lean forward and be on that forward edge for public health. So that's been our focus areas.
All right, so let me just ask you about, you've been there for you're a veteran of that agency, and then you had the financial difficulties and then COVID. Now, from your perspective, I mean, you go back 6, 7 years, a different perspective. Those have happened since then. So how does that impact the sort of transformational work that you're trying to do now?
Well, I think it's important for us to not look at going back to where we were before. We want to emerge as a better organization. We want to focus on continuous process improvement. We want to adapt as an agency. I don't want us to be in a position that we're satisfied because, you know, we're doing now what we were doing 10 years ago. I want to do something different. That's really what our transformation has been about. We're trying to innovate at the local level. We're investing more in our local public health systems. We have public health on the go, to where we have mobile wellness units that are out in communities that may not have the resources they need. We're focusing on community health workers, which is a program I'm really proud of because we recognize Oklahoma has a lot of resources. There's a lot of partners within our ecosystem that are doing great things for health, but we don't see those being accessed to the level they need to be. So we're using community health workers to go out, and instead of creating brand new resources, we want to make sure we leverage the resources that are out there. So they're working in the community. We're working with our hospital systems, with pharmacies, with the private sector, working with these organizations to get people that are in the greatest need in Oklahoma linked to the resources that can help them get on the right path to be healthy and help us to achieve our vision, which is leading Oklahoma to prosperity through health.
Real quick question, got about 20 seconds. As a just average Oklahoman, how is that transformational process going to affect them, in your opinion?
I think they're going to see better services locally. I think you're going to see us helping to close the gap where people may need services but not be able to get them. We're trying to fill that hole, but also trying to connect with our partners and connect individuals with services. That's really what we want to do, is be that connector in a community.
Commissioner Reed, best of luck. Thanks for being here.
Thank you. Thanks for having us.
You bet. See this again at news9.com/YourVoteCounts. Follow me on Twitter, Facebook, LinkedIn, @Mitchell Talks.